So what are the barriers to care? First, there's limited access to quality services. A lot of times, the way that we feel changes in the language in which we speak it. If I was telling a story of trauma and I had to translate it to English before I could tell you what actually happened, it distanced me from my emotion. So it's important for us to be able to provide services in the language that folks identify with, the language that folks experience their life with. There's also a lack of insurance and access to insurance. Like I said, lack of representation, the racism, and again, financial circumstances where services are expensive. Lack of knowledge about mental health. There's a distrust of the healthcare system that exists because we have been harmful. Psychologists in the psychology field have harmed, especially so BIPOC individuals. There's a lack of supportive guidance in a lot of ways, and often it's considered a white people thing. Like I said, it's not. And as a matter of fact, I would argue that it was a BIPOC thing before it was a white people thing, only that it has been repackaged. And lastly, there's stigma, fear of what others might say. I think there's also cultural values like no sacar la ropa sucia, no, not wearing your dirty laundry, or not talking about what's happening at home because it's inappropriate, especially with a stranger that is not part of the family, right? So I think we need to work through some of this in a lot of ways. By talking about our own mental health with others, we break some of that stigma and allow it to be okay to ask for help. Why should we care? First, mental health is a basic human right. This is a social justice issue. Secondly, mental health needs are high, but responses are insufficient and inadequate. Unless we start saying something or taking action, it will continue to be that way. This is by design. How do we get care to the communities that we serve? I think something that often comes into mind is how do we train our communities to be able to take care of themselves? Mental health systems have not kept pace with the diverse needs of global majorities, often underserving or inappropriately serving them. Individual health is community health. The better I do as a person, the better I'm able to show up as a husband, as a brother, as a son, as a community member, educator, or healer. The same way that hurt people, I believe that heal people heal people. Our ability to be with each other and connect with each other and be with one another allows us to heal. But first, we got to take care of ourselves in order to continue to give. Ultimately, by taking care of our mental health, we're able to better connect, function, cope, and thrive in all the things that we do. Talk a little bit about liberation psychology is one of the oldest, I'll say, decolonizing frameworks, maybe during a time where, again, it wasn't called decolonization, it was called liberation. It begins in Latin America in the 60s and 70s, and it was an intellectual and political movement of reconstruction of the disciplines of theology, education, psychology, and sociology. Liberation psychology emerges from the work of folks like Ignacio Martín Baró, who was a Jesuit priest, professor, social psychologist, who very creatively got to amplify the voice of the masses. He convinced the Salvadorian government to pass out census about how people were feeling about the government and their experiences, especially to those that were most marginalized. And then he brought that as findings to the government. Sadly, he was assassinated by the government in 1989. Liberation psychology re-envisions from the perspective of the poor, marginalized, and oppressed, and is created in solidarity. It was a critic of traditional psychology early on because it was socially relevant. Most of the research that was happening in universities in the United States, which already meant a very specific group of people got to be a part of that. It was an overdependence on investigation in artificial settings. Most of us don't live in labs. We actually live in a world that is more complex than that, and we're more complex as people. It was the pretense of universality when it really applied to very few people, and a pretense of neutrality. If anyone ever tells you that they do research that is objective, go ahead and call BS on that. There's nothing objective about any research that has ever been done. We get to choose the population we work with. We get to choose the questions that we ask. We get to choose the way we present those findings, unless we're intentional about trying to change some of that. In my work, I name my biases up front. You know where I'm standing from the beginning. Liberation core ideas are also important to have in mind. The first one is liberation is not contained in a single moment in time. You don't arrive at liberation. Instead, it is not something that you give or that you get to, but instead it's a process of action and continuous action. It doesn't ever stop happening. It continues to be present. And usually there's 2 points of actions. You could be an external catalyst. So educator, counselor, mental health provider, coach, community member, or you could be a member of the community who is marginalized itself. Ultimately, liberation psychology is about centering the margins. Anyway, so testimonial. Testimonial itself comes from Spanish that means testimony, bearing testimony. Is the act of speaking truth and to bear truthfulness, to witness the experience of others. Is an active engagement. It takes 2 or more people to be present in order to do that testimonial. It used to represent not a single story, but a collective reality. It is the story of many of us where stories might be a little bit different. There are points of connection throughout, and we might be able to connect in those spaces. It is both a product of critical consciousness raising. Telling the testimony will get you to better get to know folks. It will also get you to better understand yourself and understand how we move within this world. It challenges traditional knowledge and inspiration. All of a sudden, you're saying it's not academia nor people with a bunch of letters after their name that know most. It's the people that are living the experience down the street. It is a collaborative approach in the co-creation, reclaiming of knowledge.